One aspect of these efforts is reducing the duration of isolation requirements for people who are vaccinated. Effective Monday, January the 3rd, people who have previously received at least 2 doses of vaccines and test positive for COVID will be required to isolate for 5 days instead of 10, as long as their symptoms have fully resolved by that time. If symptoms continue past 5 days, then their isolation will need to continue until they are feeling better. For the 5 days following their isolation, these individuals must wear a mask around others at all times when they're outside their home. We feel this is prudent given the evidence that shows that fully immunized people have shorter infectious periods. This change is also in line with the approach Ontario and other provinces are taking and with the latest guidelines from the CDC in the United States. To be clear, anyone who has symptoms must isolate until those symptoms resolve, vaccinated or not, confirmed to have COVID or not. As well, anyone who is unvaccinated must still isolate for 10 days. If your symptoms last longer than 10 days, you must continue to isolate until your symptoms are gone. We're making these changes to help prevent disruptions in Alberta's workforce, especially for those who deliver the services Albertans count on. We believe this step will help balance the need for continuity in the workforce, the well-being of Albertans, and our need to continue to reduce the spread of the Omicron variant. We're providing an exception for workplaces where disruption of service for 24 hours or more would be harmful to the public and where there is no other way to continue the service except by bringing workers back before their isolation period has ended. In these exceptional circumstances, additional public health measures will be required. For example, returning workers would not be allowed to remove their masks when in the same room as anyone else at any time, even if they're distanced. Now, this measure to manage through Omicron is in addition to a number of measures we announced yesterday. As noted by my colleague, the Minister of Education, we decided on extended holiday break for kindergarten to grade 12 students. This announcement included 8.6 million rapid tests and 16.5 million medical grade masks going to our students and staff starting the week of January the 10th. We've also taken a step I announced just yesterday to improve access to virtual visits to physicians. I am pleased that we were able to work together with the AMA to make this change. We know that many people have avoided getting treatment they need during the pandemic due to being uncomfortable going to a doctor's office or hospital. And certainly the Omicron variant is not helping the situation. So we're adjusting how physicians can bill for virtual care to improve access while we reduce the chances for the virus to spread.
As of yesterday, we had about 21,000 active cases of COVID-19 in the province that we know about. As has been true throughout the pandemic, the total number of new and active cases in the province is greater than those figures, and this has been further changed by our necessary recent adjustment to testing protocols, similar to other provinces coping with extraordinary volumes of cases. This isn't new. From the beginning of the pandemic, daily numbers have only given us a snapshot of the situation. They've shown us proportionality and trends, what areas of the province are experiencing surges in cases, for example. This information provides evidence that has allowed us to make and measure decisions, but daily case numbers have never been an exact count. They have never included those Albertans who choose not to get tested because their symptoms are so mild or because they're non-existent and they're not aware they have the virus. In previous waves of the pandemic, we believe our PCR testing program captured about 1 in 4 cases of COVID-19. In the 4th wave, that changed to about 1 in 6. As more individuals who are symptomatic or have been exposed to the virus test themselves at home with rapid antigen tests, that ratio is dropping even more with the Omicron variant. Fortunately, we have additional monitoring tools to help us gauge the level of transmission, including leading indicators like wastewater surveillance and syndromic surveillance, and lagging indicators such as serology sampling. In addition, we are still able to monitor severe outcomes due to COVID-19 with no change. We have also had real-time data emerging from around the world as other countries and other provinces are experiencing the Omicron variant in several weeks ahead of us. as we adjust our testing approach, it is important to remember why we do testing in the first place. Testing for infectious diseases has several purposes. First, and most importantly, it helps plan treatments for those who are infected, and for this reason we must ensure that PCR testing is accessed promptly by those who need it for clinical care. Second, it helps to identify and manage outbreaks in high-risk settings where infections are most likely to cause severe outcomes, like acute care and continuing care. We must maintain timely access to testing in those locations as well. Third, testing helps us with surveillance and monitoring, which does not require diagnosis of all cases. We have been testing more broadly for COVID-19 than for any other infection we have ever dealt with, but this was primarily due to the initial pandemic response goal of containing spread of the virus by individual case and contact efforts. We do not need to document the majority of cases in order to have an effective surveillance system, and we are adjusting to the new testing approach. Finally, as I mentioned, the fourth reason for broad testing was most applicable early in the pandemic when managing spread of the virus by identifying as many cases as possible and their contacts was one of the only ways we had to minimize COVID's impact. We're in a very different place right now with respect to COVID. We have vaccines that are extremely effective at preventing severe outcomes. And we are currently facing a variant that is so infectious and spreads so quickly that individual case and contact management will not be effective. We must use proactive approaches rather than reactive ones.